Hello, hello, hello. Welcome now, Stock Trades. How's everyone doing today? All right, guys. So, as promised, yesterday I was going to do it, but I was really tired. So, I wanted to go ahead and make a live here reviewing with you guys the Wall Street webcasting of Leerink Partners for their Healthcare Crossroads Conference of 2024, where Clover Health goes ahead and released their SaaS announcement at the first time. So I want to hear from them. Now, again, some of you may have already heard this. A lot of people on our stock terminal have, and so I was able to kind of get a little bit of tip, little bit of here and there. But this will be my opportunity, first time listening it with all of you guys and kind of sharing the experience and kind of get my reaction of how I think about this. Ayo, good afternoon. It's still morning here, but 30 minutes till afternoon. Yesterday's live was good. I teared up, man. I teared up too, man. We're doing a lot of good. We're doing a lot of good. And finally, it's funny, guys. Finally, we are, everything that we've put in, all the seeds that we planted, are coming true. You see, no one's going to share your vision. You know what I mean? You're going to have to make it happen. And especially if you're trying to do something revolutionary, and it takes time. It takes time. But if you believe in it and you want it more than you want to breathe, you make it happen. Right. So, you got to find founders and companies that believe that. And it's hard to do. You got to take some experience. Yes, I have an idea. We should create a fund for good with some our gains when this happens. Absolutely. We're going to do a lot of good. You know what I mean? We're going to do a lot of, there's going to be a lot, it's about creating a community and especially there's going to be a lot of millionaires coming out of this, right? Well, once this thing hits its intrinsic value, there's going to be so many millionaires. And I'm very excited that we can document this in succession to where it's all online. So maybe like 5 years from now, 10 years from now, they're like, oh, wow, this is like kind of the thought process, right? It's normal for Wall Street to make bad articles about a company, et cetera, right? So I think we're all glad Al has some free time to sit back and enjoy the process with us. Yeah, dude, I'm so excited to be here with you guys, right? But here's the thing. After this, I'm going to go study, but I actually woke up early. I studied this morning, and then I'm just taking a little break with you guys. So this is like a nice break for me, right? For some people, I think podcast is a nice break, but I don't know. That's just me. I think it's just great, right? It's funny. I don't like going to bars, and I don't like. Remember, I told you yesterday I don't like going to parties and turning off, because like people talk about stupid stuff at the bar, right? I want to talk about what's going on with the economy. I want to talk about what's going on with the world. People don't want to talk about sports. It's fine. Or talk about girls. I don't want to talk about girls, right? So I don't like going to bars. I like this podcast and talking to you guys. That's why all my videos are lives. You can see it. It's from the cuff. I got, the only thing I have written down here, it says Georgetown post decision. I got some paperwork to do with Georgetown. But that's it. That's all I have. This little thing here says Sony, right? And some coffee. Let's see here. You're gonna be famous without even trying or want. Yeah, no, honestly, I hope it doesn't I can't I can't handle it because I already have enough on my plate. You know what I'm saying? So this is I'm cool with it, just us, But hey, if people want to learn, it's online, right? Egos on steroids often. Yeah, I did. Now, medicine humbles you just when you think. Here, let me show you something. There's something called the God, I'm going to spell it. Here it is. Dunning-Kruger effect. Yeah. So medicine's really good with this. So lots of people, when they start something out, okay, first off, there's a y-axis, is x-axis. Y-axis is your confidence. X-axis is your wisdom and knowledge and expertise. In the beginning, a lot of people start out thinking, I know a lot and everything. So I'm going to be honest with you guys. After I got my 3 degrees and my first year of med school, I was like, yeah, I understand medicine. This was the peak of my stupidity, right? This was the most dumbest part. This was the peak of my stupid. Like, I was so stupid here. Okay. Then I go out in clinical practice and I realize I don't know shit. Right. I don't know shit. Right. And then, and then, I'm still here, by the way. You know what I mean? Because, this takes like 20 years, 25 years, at least for medicine. Right. So I hope that I can go there, but still have this mentality, because that's why I like research, because it shows me I don't know shit. And that will save patients' lives right here. Here is dangerous, right? You don't want to be here. You don't want to be here. You also don't want to be too low. You want to be kind of halfway, I would say, because you also want to be confident. I'm still here, though, to be honest with you guys. But that's kind of like me, right? But it looks like a market cycle. No, it does. Doesn't it? It does. You want to be here. You don't want to be up here. Right now. You know what I mean? But yeah, I've seen people that are up here, and the level of insight is it's so. I hope medicine does its magic and humbles them. Anywho, that's just something I picked up. But yeah, we're gonna go ahead and look at the webcast. But before we do that, I wanted to show you this article. Shout out to Belize for posting this. Oh no, my bad. Palm Junior 57. My apologies. I'm sorry. Give credit when credit's due. My apologies. I'm just always like, oh, Belize did it. Belize. My apologies. This one was Palm Junior 57. All right, check this out. So United Healthcare projects shaky Medicaid redetermination aftermath. Okay, so essentially, United Healthcare is predicting an upcoming disturbance among the Medicaid, that's not Medicare, Medicaid under 65 programs are continuing to disenroll after COVID-19. There's a lot of disturbance happening in healthcare right now. Okay. And, just wanted to, these big dogs are feeling the heat, and, that's what you want. Right. So let's go ahead. I'm going to unshare this so I can share the audio version. And, that's nice. You see kind of the screen here for Clover, and you almost see like a little theater in the back. Nice little graphics they got going on here. Let me see here if I got this. Hello. Okay, good. All right, so now I'm going to go ahead and listen to this. We're going to pause and do our thing, and let's go ahead. And please let me know if you guys hear it. I'm going to play it. Please let me know if you hear it. I'm going to start and hit play now.
Here. Good afternoon, everyone. I'm Whit Mayo, Healthcare Services Analyst at Leerink. Excited about the final presentation this afternoon. Clover Health, Andrew Toy is here. I think we're going to go over some slides. We've got an exciting announcement this morning that I think's been in the works for.
Whoa! So he already knew about the announcement. We got an exciting announcement this morning. I think this thing has been in the works, so they already knew about this. Again, this is the first time me listening to this, so I might pause it a few times because this kind of gets me excited. Audible? Good. Wonderful. Let's listen.
This afternoon, Clover Health, Andrew Toy is here. I think we're going to go over some slides. We've got an exciting announcement this morning that I think's been in the works for some time. So Andrew, I'll just turn it over to you.
Thanks very much, Whit. And I have Peter Kuipers, our CFO, here with me as well. So I'll go over a little bit about what we do at Clover, and as well the new announcement we made this morning about our new subsidiary, which is Counterpart Health. So forward-looking statements, we'll make those here. So to start off, Clover has been known for our MA plans for quite some time. We're known to be a MA payer. We're mainly in the New Jersey market and the Georgia markets. But what we've always been is very clinically technology focused. So while other plans focus on managing their populations via narrowing networks through contracting, we are very focused on wide networks. We don't focus on having anchor health systems. We actually don't delegate much of our premium at all. In fact, we hold almost all our premium. I want to say all our premium. So we hold the risk on that premium. And then the way we manage that has always been through our platform, our technology platform, known as Clover Assistant. So we built that, launched that in 2018, had rapid adoption within the PCP community. It's built for primary care. It's built to help primary care physicians deliver better care by identifying chronic diseases earlier, managing them earlier.
So we know this, right? We've talked about this. I've showed you the white papers. We've broken down the science. We've done the work, right?
But for example, we have some white papers that we put out there where chronic kidney disease is being identified earlier when someone is using Clover Assistant.
Remember those white papers we talked about, the early identification of diabetes, chronic kidney disease, and medication adherence? All right.
And I'll talk more about that in a second. Now, all of that benefit is flowing into our MA plans right now, and we're very proud of the margin improvements we've had in the last couple of years. We're proud that we are targeting adjusted EBITDA profitability this year, and that is all driven by this very specific care model, which is physicians using Clover Assistant, primary care physicians using Clover Assistant, and in some cases.
So I just want to pause real quick because like you guys are saying some things that I'm noticing right now. I was going to say it and you guys said it. So I love how Toy speaks with great confidence and power. Toy's accelerating in confidence and competitiveness. You could see he's speaking like I don't know how to explain this. Like I know, like you guys need to listen to me now. We're about to show you what we're made of. Like you're about to see why Google bought a company from me back in XY amount of Z years. Okay, like shut up and listen, pretty much, right? So I do like the confidence. I know I'm noticing it too.
Some specialties using Clover Assistant as well. And that is what is, you can see here on this slide, is on the left-hand side. That is what we traditionally have been known for, is a Medicare Advantage plan, focus on the wide PPO with a care model that can actually manage care on that wide network powered by PCPs using Clover Assistant. What we announced today was we are taking the next logical step. We are making our assistant technology and platform available to PCPs who are managing MA risk for MA Medicare eligibles who are with other payers. So under this scenario, we are branding that Counterpart Assistant. While our parent company is Clover, our Clover brand is synonymous with our MA plans. So we have a different brand that we will be bringing the assistant to market with, which is Counterpart Health. It is the same.
And I think this Counterpart Assistant, which is the same thing as the Clover Assistant, I think it's going to be targeting those ACO folks on the Medicare side. I think. But
technology platform though, for a given primary care physician using the assistant, they would not know the difference between these two things. In fact, you can think of Clover Assistant as actually a white label of Counterpart Assistant.
It's a white label, so it's just the same software
for the purposes of the Clover MA plans. So hopefully that makes sense to people. So Counterpart Assistant is the core technology, and we are now making that available to MA risk-bearing providers, to provider-sponsored plans, to plans who are looking for help improving their MA performance. And Counterpart is now, we announced today, generally available for that scenario. It's the same proven technology platform. We've been building this since 2018. We've proofed it within our MA plan. We've talked a number of times about the performance improvements we see with PCPs when they move to Clover Assistant, now Counterpart Assistant. And so we feel very confident that the technology is built. That is the same technology that will be used in all scenarios. For a PCP, they're getting data-driven care. They're identifying those chronic diseases earlier, managing them earlier. Doesn't matter whether it's the Clover MA plans upstream of them or some other MA plans go upstream of them. So we feel very confident that this business enables us to generate value and generate benefit for those in risk-bearing arrangements in other markets where our MA plans are not present.
Yeah.
So for the value proposition,
see, like going in, that Counterpart Assistant going in where their plans over there are not present. And this might actually give him this might actually help them expand in that area too. I mean, dude, Clover's going to be a beast. I mean, they're playing a nice game here. They're going to help people save money. They're going to collect that data, and I'm sure they're going to use that data to train on. And I'm sure that data is going to give them information on how to expand their MA plan. So they're ultimately going to but they're going to ultimately take from the competitors. I think, right? It's looking pretty good.
This is a cloud-based AI power technology we have already
saying the right words, cloud-based AI. And I knew this was cloud-based like 3 years ago, right? I knew this, right? So we're finally speaking the language here, okay?
built data integrations, so we can come with our own data in a lot of scenarios, and we basically have very little integration we have to do. We know it works because it's been proved within our own MA plan. We know that it is something that clinicians are excited to use, and that when they do use them, and again, please, if you haven't seen our white papers, please look at our white papers that show better outcomes on medication adherence, on earlier diagnosis of disease. These are really important dynamics that give better outcomes for the patient and also directly translate into superior loss ratios for an insurance company or risk-bearing entity when those things happen. So we think that there's a lot of value that we've already proved out through early diagnosis. It lowers medical costs through early management, and of course, just generalized quality improvement, HEDIS gap measures, things like that for stars. For Clover Health,
for star ratings, it helps with star ratings. Yeah, he said that very quickly at the end.
Parent co in this case, this gives us a way to deploy our existing technology asset, something we've already invested a lot of resources into building.
You see, for that growth and profitability, this, I mean, they're speaking the language, man. This is it. Like, they're speaking Wall Street's language.
And gives us another revenue stream to actually bring this to market. The way I like to think about this is that there's all the MA risk that's out there that needs to be managed. We want to manage that with Clover Assistant, Counterpart Assistant. One way to do that is to bring on that medical risk through our own MA plans. Another way to do that is to go into partnerships with other risk-bearing entities and scale that way. So one is a B2C motion, one is a B2B motion. It's something that we learned from our experiences with ACO REACH, where
you see, they learned that from ACO REACH, and they took all those patients, the 200,000 patients, and they realized that, oh, we can make money here rather than the whole thing. We could do it here. And remember, guys, they were growing 50 to 100% year over year with that method. But they realized that part of that method, that maybe they needed to do that to get all that data, and they found a nice, beautiful clover leaf at one area. They're like, we're going to go ahead and go in there, and we're going to scale the crap out of that area. And if that happens, then the upside is let me just look up, right? The upside is huge, right?
This is something where we know we can scale using that B2B motion, except now we're not doing it with original Medicare risk. We're doing it with MA risk, which is something we are specialists at. So the business model here that we're delivering is when we're doing this with Clover plans, we obviously are holding full capitated risk in that case, and that's the business model. When we're doing this for other entities under Counterpart, what we're going to be doing is having a PMPM component, a recurring revenue platform fee, which we think will generate that recurring revenue, and which
recurring revenue. It's sticky. They need it, and it's not going to go anywhere. And it's less overhead, high gross margins. These are the things that the words that he's saying. Recurring revenue. It's triggering these words in my mind. High gross margins, yada yada yada. So this is what he's communicating, and what Wall Street's thinking. This is what they're thinking. Right? This is what I'm just telling you out loud, kind of what they're thinking.
We think that will be priced well, given that the amount of value we're generating.
Will be priced well, right? Good.
And we will also have tech-enabled services revenue, which is basically the value-based care component, where we will participate in shared savings. We are looking to launch into upside arrangements here to start, meaning.
Yeah, and just really quickly before he starts about the upside arrangements here, I remember that company for the depression for seniors. Yeah, they're going to expand into that. That's going to be one of the companies we talked about it in the stock terminal, right? That's just So they're gonna go all over the United States,
Upside risk only deals. We could eventually move to full capitation or downside risk, but we're not doing that to start. To start, what we're doing is upside gain share combined with SaaS-like recurring PMPM revenues. That gives us two different kinds of revenues, which we think will be very exciting. Right now, we've brought this to market. We've shown it to a number of people. We feel very good about the product market fit. And so what we are doing is trying to launch into deployments, and we're focused on closing those deals, getting those deployments this year. Revenue will not probably start landing this year. Some will land, but it won't be that much.
So some will land. It won't be that much. So we'll see how much of that will land. They'll have to disclose it on the earnings. And I think the big one might be 2025, but definitely I'm looking at 2026, 2027. Then this thing rolls out like butter, and that's going to just be huge. But I think the market, once they see it, they're going to price that future growth, especially when they do their Q1 guidance for 2025, like they did last guidance and last quarter. I think that's going to be where Wall Street's going to be like, okay. So what I want to do is I want to monitor the SEC 13F filings now, especially after this announcement in the next 3 to 6 months.
But we'll be closing those deals and then ramping into those deals for revenue generation in future years.
Future years, yeah. See.
So across the board, just as a reminder, and this is something that we show, this is a short summary of what we are actually demonstrating to people when we go out.
Yeah, just pause really quickly. AF right here said something really important, man. He said that I think his plan is to go extra hard in 2025, rolling these new services out and taking profit in the future. That's exactly true. And those revenues are going to basically help drive Clover higher and hopefully add some profitability up in 2025. Why do I care about that? Is because 2025, they're going to be paid at 3 stars. Didn't I tell you they're either going to have to increase their amount of revenue or figure out a way to create a new line of revenue stream? And that's what they're doing now. This is it. So they're protecting themselves for 2025, and hopefully in 2026 we'll get a 3.5 stars or even a 4-star upgrade. So everything's looking like they're making the right moves. Like if I was a CEO of this company, I would be doing exactly what's happening right now. Everything he's doing exactly what he needs to be doing. There's not something that I can't think of right now that he's not doing. He's checking all the boxes. And I'm just not trying to focus on him. I also want to thank the whole Clover board management team, the board team, the CSO, the CFOs, all of them, all of them, CMOs, they're doing all a great job. Okay. All of the, patient care techs, the nurses, the whole thing, they're doing a great job. Okay.
Out there to sell and to partner using Counterpart Assistant, our CA technology is driving all 3 of these columns, right? It's driving proven clinical outcome improvement, earlier diagnosis and treatment of diabetes, early diagnosis and improved disease trajectories for CKD, adherence. These are just the white papers we've written, right, and published. We'll be publishing more of these white papers, but these are the 3 that we've done so far. Great evidence of improved care there. We think we're one of the only payers really be able to prove this and to show this. That 1,000 basis points of MCR differential, returning members who see a Clover Assistant.
It's actually more than 1,000. It's 1,000 basis points plus. Clover themselves got 2,000 basis points decrease. Because remember, their MCR was over 100%, especially on the Medicare Advantage side, and they dropped that down to 79 to 81%. If you don't remember,
the PCP have over 1,000 basis points on the loss ratio superior than those who do not. We talked about the adherence. These are just the white papers we've written, right, and published. We'll be publishing more of these white papers, but these are the 3 that we've done so far. Great evidence of improved care there. We think we're one of the only payers really be able to prove this and to show this. That 1,000 basis points of MCR differential, returning members who see a Clover Assistant PCP have over 1,000 basis points on the loss ratio superior than those who do not. We've talked about that for a long time.
What happened? Why? What's going on? Hold on, guys. It's not hold on. It's not playing. Now let me see. One moment here.
This is the PCP.
Huh. That's weird.
These are the key things that we were discussing earlier at the keynote around, obviously, when we go to
There,
partners
here it
who
is.
want to look at improving their performance and quality measures
Let's
who do not.
let's
We
go.
talked about that for a long time.
What? Come on. There's something wrong with it. It's pausing at 903. So I'm just gonna fast forward it a little bit over 305.
Obviously, when we go
There
to
it is.
partners who want to look at improving their performance and quality measures. And you can see this on the right-hand side here, improvement on various quality measures around colorectal cancer screenings, breast cancer screenings, osteoporosis, etc. These are the key things that we were discussing earlier at the keynote around
And this all helps with star ratings, guys.
star ratings, etc.
Well, there you go. You see there, he said it. We are thinking on the same wavelength. Okay. This is good. I like what I'm seeing.
Driven by primary care, driven by improvements when people have that data available at their fingertips, provided by Clover Assistant. Ultimately, I think that if you want to think about what is the key thing that we bring with our assistant technology, it is we are able to drive differences in PCP behavior.
So this is actually really good. For some reason, I don't know why it's like you can't really read that. So I have the PowerPoint slide pulled up. I'm going to zoom in real quick here, and I'm just going to talk to you guys about what's here. So you remember that paper they posted on the medication adherence? You guys can't see what I'm talking about. Let me just share the screen real quickly here. Okay. Oh, you just cracked your iPhone screen. Oh shit, that sucked. Well, that's okay. I'm gonna go ahead and I'll like speak and describe it. So this is like the Clover Assistant. They got some flags here. Prescription not filled. Atorvastatin. What's atorvastatin? So it's for cholesterol, right? It helps lower your cholesterol. They got a patent on this technology. So like the doctor now knows, hey, this patient didn't get his atorvastatin. Let's click on the details and okay. Hey, this patient was discharged from the hospital 6 days ago. With a hospital diagnosis of heart failure. Let me go ahead and let me go see kind of, if he's on lisinopril, if he's on, if he's on the mat, right? Goal-directed, evidence-based management therapies for heart failure. You get where I'm going with this? Supporting evidence. These are his labs. Does this patient have any of the following? You can kind of look at this, and the clinician can click on it based off of not just the lab data, but the overall general trend of the GFR given the time point in the graph from, January to June, 6 months regarding GFR and consistency, not like just, this is his baseline. So yes, this person does have stage 3. Then you can look at all these other things. So you can see that the healthcare is being supported by Clover Assistant or by Counterpart Assistant, whatever have you. And it's a good, EHR, right? Integration. So, EHR integrated fits well with clinician workflow. So let's go ahead and let's go back to this here. I just wanted to just point that out because I wasn't able to see it clearly here. And I just wanted to, just make sure we're on the same wavelength here. Okay. So let's go ahead and play that. Okay. Let's increase the volume. Let's go.
Without the PCP feeling that their arm is being twisted, we aren't giving them artificial carrots, confusing benchmarks. We aren't giving them sticks where we're saying you're going to be punished if you don't do this. We are arming them with information. We are in a clinically intuitive way. When we demonstrate it to them, we're like, hey, look, you're going to see this information. It's going to help you make decisions. You make the decision you want to make, right? That's how doctors want to practice medicine.
Exactly. So you remember I showed you how it says, does this patient have like, any of the following? The doctor's making the decision. It's not saying this patient has this, because sometimes a patient's GFR can dip, and it can just dip for a variety of reasons. And it may not be like, I personally had this where I saw a patient's GFR and it dipped, but it's like, this is a trauma setting. So, this patient, so you can't physically say that because you don't know the patient's baseline. So it gives the power to the physician, because this thing was designed by doctors for doctors, right? So that's ultimately kind of, yeah.
We aren't compelling them to do anything. It is integrated into EHRs.
It's an assistant, Clover Assistant, Counterpart Assistant. It is not I'm going to take over. It is an assistant.
Choose to use the EHR integrated version. They can choose to use a standalone cloud version. Either way, we typically launch this with just an hour or so of training for every PCP. And then new versions deploy from the cloud automatically.
An hour just to get them deployed. It just shows you the scalability of this thing.
And we don't have to do retraining for PCPs when we do that. It's all a cloud-based tool that's designed to be elegant and easy to use.
And if you don't recall back 3 years ago, the earnings report, he says that this is the Tesla of EHRs. It's going to be continuously updated through cloud-based to where if, let's say, a New England Journal of Medicine pops out, and let's say this is the new themed evidence-based practice, this is going to be basically uploaded just like how a Tesla car updates. This will update as well.
So ultimately, what I think we have demonstrated with our capabilities is we can take data, we can generate insights using rule sets, research, AI, and then we are able to deploy those to PCPs in an intuitive way that allows them to change their behavior and improve care and improve outcomes. And that's been proven within our plan. That's what we're now bringing and making available to any entity by Counterpart.
Yeah, a lot to unpack there.
You see, in one of the participants, I don't know if you heard that, he said, "Oh, wow, lots to unpack there." Yeah, if you watched Al Stock Trades, you would have seen that we've unpacked it for you. But you know what? You can go ahead and take all the time to unpack. Just know that the big boys are starting to pump it back into the stock. So you better unpack fast, my friend. You better unpack fast, right? All right, so. Thank you, man. Al, bringing sanity to the CLOV investors. Thank you. Hey, man. Thank you. And thanks to all the CLOV investors, the retail community space, it's, we're all in this together, right? So It's been good. Let me see where we're at. All right, so I think maybe we might get some questions now. I don't know. Let's see.
Thanks, Whit.
First, let's talk about kind of the work that you did leading up to this announcement. You mentioned that there's been some productive conversations, I would presume, across risk-based physicians,
Yes.
MA plans, and I'm sure someone else, other providers.
Yes.
What do you see of those three buckets as perhaps the more immediate addressable market to begin?
That's a good question. Like, what are they going to go into first, and what's going to go on that revenue and free cash flow? Excuse me.
To grow?
Yeah, great question. The way I think all of that is there, as you said. The quickest pathway in we see right now is going through the providers, because you can actually do two things.
Yeah, because they already know the providers. They pulled out of ACO, and they just, they're like, hey, but if you like the Clover Assistant, well, now we just have that by itself. So I think they're going to go to them first.
You can go straight to a provider and say, hey, launch with us, right? And they are generally already have, people we're talking to already have risk-bearing arrangements. If they're on fee-for-service, that's a later phase where we'll help them go to risk. Right now, we're going to providers groups who already have risk arrangements with upstream payers.
Okay.
And then so they're like, okay, great, I want to just improve my performance. Therefore, we do the demonstrations, we show the clinical benefits, they get excited. And then what we say to them is, the great thing about this is there's no full transformation of the practice. They can just roll this out PCP by PCP and just do five PCPs, 10 PCPs, 20 PCPs, 50 PCPs, just like we do in our own MA plan.
Right.
And then that scales up quickly. So we find that is a very good way to actually come to market.
Okay. Many risk-bearing groups already have a form of technology, not Clover
Hey, good question. Hey, other people have technology. What makes yours different? That's probably the question.
Assistant, but can you integrate with their existing systems? Do they have to operate, on a standalone basis?
Great. Yeah. So normally what we see is when we come in here, we say we're doing something different, right? So and they're like, okay, what are you doing? And we show them the demonstration, we show them the clinical, and we have a very good hit rate of saying, okay, this is different. This is not the same. This is not the same as other things we're doing.
Yeah, they have a good hit rate because they have doctors leading it. Doctors are going to communicate better than a company that doesn't have doctors. They have a sales rep, right? Salesmen. Us people in healthcare, we don't like salespeople. And then also they got a computer scientist leading at the helm to design this thing with all of his machine learning experts.
So we see that we are additive to anything they're doing,
yeah,
and that they've already deployed. We've had a lot of conversations. We feel very good about that product differentiation. So what we say is, if you're already using Pop Health tools, this is not a Pop Health tool, right? If you have like a general analysis system and you want to just generate dashboards, you want to generate sort of like lists and things like that, that's not this. This is a personalized care system. So you can just keep using your Pop Health tool and you can add this right on top. This is not like a replacement for the EHR, right? This adds on top of that as well. You can keep whatever you have turned on there. It's additive as well. So we tend to be able to prove that this is additive to what they're already doing, and also therefore additive in terms of value generated.
Okay. And the price, this is all going to be on a subscription basis, a price per member per month.
You see how they're talking about subscription. We're talking about SaaS. The business model is changing. It's no longer a CMS. You're starting to see price to sales. How are you doing? Good afternoon, my friend. Cloud-based using cloud, Google Drive. I think they have their own. I don't know about that, but I think they have their own cloud storage. I think that's a good question to ask.
Yes. So we are going to have the platform license fee, which is going to be a recurring revenue format, so a PMPM.
Very nice.
And then we think this is really its own product. It's born in a plan. It's really built for.
It's its own product, pretty much. This is a whole business.
For managing risk. So we're not bidding this as like an HCIT solution. It could fit into that category, but it's not something where we'll respond to RFPs and things. It's really its own pitch is what we say. So we'll have that PMPM where we're like, that's what we do for the platform. And then we always want to participate also in that upside as well, because we have such conviction we can help. We have such conviction that we.
Oh yeah, back-to-back live streams, and signing up Humana, that'll be in United Healthcare. Oh, that'll be the dream.
Can add a lot of value. We want our partners to also have that conviction. That's part of the sales pitch. And when we see that they believe that, then we believe there's plenty of economics for us to share.
Okay. Unpack the upside. You want to participate.
Unpack the upside. Good question.
In the upside over time. So to the extent that they are showing improvement in MLR, you get a piece of it.
Correct.
I want to know how much is the piece so we can calculate.
That's right.
Alignment of interest. That's always a good thing to see. What type type of investments do you think you need to make between now and launch date to begin the commercialization of this in the sales force? And I'm sure not all of that is in the plan that you have for this year. Maybe it is, but.
So we think that we are already well on the way to have the first few customers signed up, and we'll have more to talk about that as those roll out. And we already have a number of folks who are actually deploying as we speak right now with commercial arrangements in place. So that's not a scale deployment. That's more of
Pilot.
I wouldn't say they're pilots. It's just that we're not sort of like jamming the funnel right now and flooding the funnel. They're not pilot. They're production deployments. We're beyond pilots right now. So we're deploying there. They will be revenue generating. So the business model is always can be customized, but it's pretty well tuned. We're not looking.
And now when you talk to chartered financial analysts, which was kind of the creme de la creme of Wall Street, when they work on those hedge funds and Wall Street firms, they're looking at this and they're like, oh wow, this is an actual business model. Okay, let's get the IVCs, let's get the intrinsic values, let's go ahead and get started. We're on that path now.
To just sort of go massive scale. We learned from the ACO reach that we don't want to overly.
You see, we learned from the ACO reach, and they probably learned not to overdo it. So they're probably going to go slow so they don't affect their star ratings. Let me go ahead and just kind of restart that because that was really good. Let me go ahead and go back.
Like jamming the funnel right now and flooding the funnel. They're not pilot. They're production deployments. We're beyond pilots right now. So we're deploying there. They will be revenue generating. So the business model is always can be customized, but it's pretty well tuned. We're not looking to just sort of go massive scale. We learned from the ACO reach that we don't want to overly scale too quickly. We want to make sure we get our sea legs under us, even though I have very good conviction around this particular business.
See, he wants to go. Andrew Torrey wants to freaking scale fast as hell, but he learned from his past. We're, just make sure we do it effectively with growth and profitability. Second, profitability in mind to make sure things go smoothly.
Business. And so yes, there's some sales team investment. We've already made a number of those.
And yes, they have made a lot of sales team investment. Think of the vice president of SaaS sales. They've done that. They've done the work.
We believe that the support model will be very similar.
And we've done the work too, because we found that on LinkedIn as well.
To what we already do within the MA plan, right? So we're very familiar with what it takes to support a provider from the Clover MA plans. We're going to prove that out, just make sure that deployments proceed and are clean, that support model bears out. But we feel pretty good about that as well. And from a technology perspective, the investments are pretty much already made. And so it's going to be a generally high margin.
There it is. He said the word. Investments have already made. It's going to be a high margin. That just basically, that word went into the guy's ear, went to its auditory cortex, specifically entered the 8th cranial nerve, went down to his nucleus tegmentum area where a lot of dopamine is released. And that dopamine just went into that Wall Street guy's head and it just went, blah, 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 okay? And he just basically got a hit of the reward pathway. And watch, he's going to follow up really quickly right now with a question, just intrinsically looking at how human beings are.
Business.
Yeah, the gross margins we estimate will be significantly higher than the current margins on the MA plan.
There it is.
What level of customization can the users make in terms of the care gap intervention and how the workflow works?
Yeah.
So that's a really good question.
Sorry, is Abdullah Magla?
Right now, we do not allow for very much customization at all. The way that we think about it, and we're open to it, but generally we've not had to do any customization. Let's put it that way. The reason is that the way we talk about this is once again it's additive to the existing workflows, and it is something whereby we kind of like to think about it as GPS or turn-by-turn directions, right? Like this is something where we're going to make suggestions. The suggestions are optional. The PCP can practice medicine as they see fit, and then they can go through a list of suggestions that we have, insights that we produce, and they can just react to those and respond to those. Because of that, we haven't actually had to do a lot of customization. It tends to be fairly intuitive. What we do have is sometimes they want to see that inside their EHR versus on a separate pane of glass. So the pane of glass issue does come up, but not sort of a workflow or data stream customization.
So the medical groups that are currently using, it's not called Clover Assistant anymore. It's called, what's it called? Counterpart.
Yes.
Counterpart. Are they
what's it called again?
currently paying you a PMPM right now?
The ones who are launching under the Counterpart model, yes.
Okay.
They are.
Yeah. Okay.
Yes. That's why we're announcing the general availability. So another way to put it is the pilot phases, we believe, or like if you do a new like sale, of course you might always do a pilot because that's a
And who knows, maybe that pilot sale is what Chamath's been talking about. I don't know.
prelude to a sale, if that makes sense.
Yeah.
But the phase where we're sort of testing the business model, testing those kinds of things, I feel like that phase is now concluding, and we're ready for general availability, which is what we announced today.
How easy is it to integrate with a lot of the legacy health plan systems?
He said in about an hour, but now he's talking about Humana and United Healthcare. So we'll see. That's a good question, because that will make the upside huge.
Today, so that they can deploy it to their doctors, or is it not that they work on a license with you, or they're like, we're going to pay you a PMPM for your services, and we're going to allow our downstream medical groups to use it? How does that work?
It's so every deal is a little bit different, because I'll speak in generalities here. Generally, it is what you just sort of said, where we are generally contracting with a higher up entity. So I'll make up an example. Let's say there is an academic medical center, and they might have a SIN, right, associated.
And they already know academic centers as well, like for example, Penn State and all these other places and whatnot. So yeah.
With it, which has got a bunch of physicians, community, their own docs, things like that within the clinically integrated network. Then they will be paying us a PMPM for that SIN, basically. And then
that's going to be huge, because Banner has his own kind of insurance as well. So this might even be able to go into other hospital systems. It's really smart.
they will be moving chunks of folks.
Like, I'm sorry to keep interrupting, but we're thinking about Humana United Healthcare, but there are other people out there that are in the millions of dollars that they can pay Clover, especially with those high gross margins, high price to sales, and high evaluation ultimately for the intrinsic value.
Into launch. So they won't just say day one, we're going to pay you a PMPM on everybody, but what they'll select is on a launch plan, these sets of folks will go first. We'll get them going. Then they'll stop paying on those. Then the next wave will go. We'll stop paying on those. It is basically based on launching doctors. So they'll identify physicians who are going live, and then the attributed population will go live at the same time, and then the PMPM will be paid on that population.
Okay. What would be a manageable or reasonable level of growth in any 1 year?
You see, again, they're asking questions. First, they asked about the gross margins. Now they want to talk about the growth. All those are variables for the intrinsic value calculation.
Launch this.
It's somewhere between, like, one practice and the number of ACO practices we launched, which was a lot, like in one go. But I think what we saw is that we have the capability. Well,
so he pretty much hinted, it's like, you remember our growth rate back in the day at 50 to 100%? Yeah, it's a lot.
Reach toward us, while that was ultimately not the right program in original Medicare, what it did teach us was that we were able to pull a lot of risk in very quickly through this B2B methodology and sign a lot of contracts very quickly. And I think
sign a lot of contracts very quickly, a lot of growth. We're going to go to the moon.
Shooting this to be like MA is on MA makes it a lot more, a lot safer, let's be honest, right?
Yeah, and then with the whole 1,000 basis point reduction, it already worked with their old MA plan. So
because it's upside only risk, we're much more familiar with the MA program.
Only upside risk, guys. I'm feeling good.
CMMI could make changes, like, MA is less vulnerable to that by statute. So I would say that we are being judicious and disciplined in how we roll it out, but I would hope that this would scale like a software business when it's fully rolling.
Like a software business, that's going to be insane, guys. That's going to be like, so you like the interruptions, keep them coming. You add value. I appreciate it, man. I really, guys, how much you think? I want to know too. We'll have to get to those once they do their earnings. I'll be able to do. We'll be able to see. And I agree. All these are stellar responses. I mean, guys, this is like are you feeling what I'm feeling right now? Like, I hope we kind of had kind of like Elon Musk said, we kind of share the feeling together in social media. It's almost like we're all connected. Like, are you feeling what I'm feeling right now? I'm really excited right now. Are you feeling this? Like, like when, I'm already taken, but like when I first met my girl, I was like, does she like me? Are we feeling the same thing? Are we feeling the same thing, guys? You feel it in your bones. Dude, I feel it. I feel it in my soul. Okay. I feel it. Okay. All right, let's continue. Yeah.
What have I not asked about this?
I think that.
Oh, what did he say? Let me restart that, because I want to make sure I don't miss anything here. Let me just. I don't know what he said. He said something funny. I don't know.
Vulnerable to that by statute. So I would say that we are being judicious and disciplined in how we roll it out.
I gotcha.
But I would hope that this would scale like a software business when it's fully rolling.
What have I not asked about this?
Yeah, I know what he said. The belly dancer from last night. I was expecting like a Middle Eastern belly dancer. I was
think that the thing to think about here is, why are we fundamentally different than value-based other value-based schemes, and why are we fundamentally different from other technology schemes? And I think that the answer is, whenever I think about this, is that we sit as Clover in a very unique intersection between the two things, right? Very few full risk-bearing entities like the MA plan are completely reliant on technology to generate their you know, I've talked about this a lot, right? Like just no one takes that approach, right? And so we have that experience. When we compare ourselves to software companies, we can command, we believe, a significantly higher margin and price premium over regular software companies for a PM and upside basis, simply because we can point to the results within our MA plan and say, look at how much value we could generate. This is worth it. And that's something that's very difficult for my software compatriots to be able to do. And so when you go to the value-based guys, they totally understand the value side. They don't have a software tool. They have all these other practice transformation. They have all these other ways they do it, but it's not software-based. When you go to software folks, they totally get that, but they're completely on ARR. They're completely on, I think, diminishing somewhat like fee structures as they compete with each other. And what we're hoping to do here is bring those together. And when they come together in that intersection, have a unique offering for the space.
Okay. Anything else, Peter?
Peter's very excited.
Yeah, I'm excited.
You see this? Anything else, Peter? And he's like, Peter's excited. And he's like, yeah, I'm excited. I mean, guys, everyone's excited. Okay, like I'm excited. You know, we feel it in our bones, in every little friggin' bone. We are excited, right? This is exciting. Okay, we knew this was coming, but just to see it here, and now we're going to see it on the the earnings report and the annual 10K report. Oh Lord, it is looking good. It's looking good.
Yeah. I would just point out maybe also just the incremental cost for deployment is really low, right? Because the technology is already built.
Yeah, a lot of SaaS companies are like, well, we have to build a technology. It's going to cost us a lot of money and yada, 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 cash burn. Hey, this technology is already built. So the cost is going to be low. So it's only going to be upside, dude. Yeah, you understand it now, little Wall Streeters? You get it? I used to tutor a lot of these people in business school before they go to Wall Street. I used to be an executive MBA TA for the economics portion before these guys go to Wall Street. You know, I know how they think. These folks need some time before they see what we already see. And now they see it. Now watch the money start flowing into Clover.
Platform is there, proven results.
All right, that's what I was. I wish to do some less fun stuff. What was the work leading up into the overall launch? Like how long has this been in the works? How many years and months? And
so the technology is the same technology.
Yeah. So that's a question is, well, how fast did you build this? Because I want to know how fast it was built, because it'll most likely take a competitor half of that to build what you already built. You see that question? That's what that question means. You have to read between the lines. Okay.
You think here is like, we've been investing and we talk about this for a long time, right? So the tech is there, the tech is there, the tech is there. Then I would say there's a bunch of learnings that we got from the REACH program, right? That is factoring into how we think about it.
So that, the REACH program was like, damn, that was a lot of money, but that, that was an investment. That was an investment. They lost that money and that money taught them.
This now, because once again, different value-based program, but similar B2B motion, contracting, all those kinds of things. And so we've been working on this version of it, probably really, really in earnest for about a year now, and really taking it to market, probably really focused this year.
Okay. All right. We're going to have to do some follow-up calls about this. It's exciting.
Yeah, it should be good.
We're going to have to do some follow-up calls about this. Yeah, buddy, you better do all the follow-up calls you want, all right? And you better do them quick, all right? Because the news is out. The news is out, right? Retail was right on this one, baby. All right? Don't let your, we'll sell it to you. We'll sell it to you when, well, they want to buy more. We'll sell it to you at the right intrinsic value, my friend. We're doing good. Remember to hold, right? Again, not financial advice, right? But this thing's upside's huge, okay? So all these Wall Streeters are going to want to take that from you, you know? And we worked very hard. Right? I'm not too sure. Could have been a buyback. Strong work, Bill. Could have been a buyback. Who is the guy asking questions? I came in late. I don't know. I think it's the part of the Leerinks here. You know, we got to go ahead and give you a call back. And there's a lot of things to discuss. What do you think they want to discuss? They want to discuss, I want to buy a bunch of your business now, right? This is good. We're feeling good, guys. We're feeling good. Let's go. We're feeling
Are your
good.
bids in yet?
Uh,
I'm kidding. They should be soon.
They're making jokes now. They're all friends. Before they just looked at them as like, you know what I mean? Yeah, now we're friends, right? Now you realize that we actually know what we're talking about, you know? We actually have a good software. Now you guys are right? Yeah, shows you how America works, right? Capitalism. Freaking funny, huh?
They should be, but like we've had a final bit of tuning. Bid should be in clean this week.
What do you think the biggest surprise will be in a few months from now?
The biggest surprise. We're going to have Christmas early this year, guys.
Once we see everyone's bids.
The biggest, so definitely, as you were talking just earlier today with John, I think the real sleeper is Part B, right? Like it is
the real sleeper.
And that's because there could be some massive unknown, right? But the massive known unknown in the Part D national direct subsidy, right? Because as all this risk moves into the PD portion of the plan, you're going to see premiums and stuff all move around. You're going to see basically even the the patient-facing portion of this all move around. And I think that's something that people aren't talking about enough as well. Is we talk about this in an MAPD context, as of course we do, but it should also be discussed in a standalone Part D context. I don't see a lot of people talking about the effect on standalone Part D, and I think that could have a significant effect as well, which would then affect obviously sub and fee for service, and then that affects MA, if that makes sense, right? As it cascades. That's what I think we should all be keeping an eye
Got
on.
it. PPO, HMO, you guys have had for a long time an orientation around open access panel. How are you sort of experimenting more with HMO going forward in any of the new markets or in New Jersey?
We are not looking at our HMO product. You know, obviously at this stage of the bid, we don't talk about it. None of us talk about it because we don't want to have competitive
Long-term
information.
strategically,
Yeah, but strategically, I think it's pretty clear that HMO is not central to our strategy, right? Like that wouldn't surprise anyone. That's not giving away competitive information. So really the way we think about it is at the end of the day, everyone else really has HMO as the way they can manage costs. Even when they had a PPO, it's really trying to wrap around certain anchor health systems that help manage costs. And the more people go into true PPO wider networks, the less plans were able to manage those costs, which I think has led to some of the effects that we're seeing in the broader market.
Agreed.
So Clover Assistant is a good salve for that, by the way. And so that's why I think Counterpart it's great timing for Counterpart to come and help with some of that. So we want to help with there on the Counterpart side. And then for us, that PPO network, the community doctors, those kinds of things are really our sweet spot. We don't really think that HMO is the place where we would focus. We might do some innovations, we might do some experiments, but like it's not a place that we particularly feel like we have to go.
Yeah. Every time I go back and look at my Clover model, I get surprised this year with the growth that you have in your PMPMs. And I know a lot of that is you haven't been growing the book as much the last 2 years.
Yeah, so it's aging.
And it's aging.
Yeah.
So you're getting better on coding and other things. But maybe just bridge me, like how much of that improvement in PMPM is coming from cohorts and coding and whatnot, just the maturation of it.
Of course. So like there's generally like 3 dimensions that are going to flow into that, right? One of it is going to be as the cohorts age, you know, 1 year is hopefully like not a lot for regular people, like in terms of health, like it doesn't make a difference. 1 year is a lot for the Medicare population, right? Like there's significant increase in sickness burden in 1 year. So dimension number 1 is just demographic aging and the cohorts aging. So that's one part of it. And we're doing pretty well keeping a sticky membership base. They're staying with us. We're not growing a lot. And so, as you said, those cohorts are aging. That's dimension number 1. Dimension number 2 would be the generalized documentation of the sickness burden and identification of the sickness burden. The way we think about that is 1, you should always be good at documentation. If they have an actual condition, you should document it. That's just good quality documentation. Number 2, remember Clover Assistant is also, a lot of our AI points to this, identifying diseases as early as possible, right? That doesn't mean that that person wouldn't eventually get treated for a disease. It just means they're getting treated, identified and treated a year or maybe two earlier than they otherwise would. So as you see that effect cascade in, that also affects the revenue PMPM side, because if we find out you have CKD, we're going to start treating it as CKD, but you also get the diagnosis earlier, right? So that effect is definitely flowing into the cohorts now in a very recognizable way. I want to also just really point out that a lot of the stuff around V28, et cetera, I think a lot of people that have challenges there, because while we have always focused on chronic disease identification and management, what CMS really targeted, as John said earlier, was codes that did not have really any management. They just had revenue, and those were now have been pulled out, and I think appropriately so. So that falls in that second category, and we feel good about where we stand on that. And then the last category is the bid, basically, right? If the more aggressively you bid, basically the more your revenue will come down. And because we've not really pulled back aggressively, but we've stopped adding every year, and others have caught up to us a little bit, I'll admit that, and that's slowed our growth. But because we're no longer adding to benefit richness as much as we were before, that's also helped on the margin side.
How do you feel about some of the new states that you guys have grown into? And are you adding additional investments into new states, you feel like, or is we back to, New Jersey, the core at this point?
New Jersey is the core for our plan. I'm not saying that we wouldn't expand the MA plan. We have thoughts about how we would do that, but we used to sort of measure ourselves on how many counties are we going into this year and that kind of stuff. I don't think that that's the right growth strategy for us. You don't want to just have network adequacy and licensure. It just creates a cost basis that doesn't have a return on it. So what we really look at now.
So now they're realizing that that business doesn't really have a return price of sales of 0.5. So they're trying to see how. Yeah, that makes sense. Let's let them finish.
Is all on a PVP basis, on a county basis, on a market basis. Where is the profit being generated from? And focusing on how do we grow more in those particular markets, because that is how we grow sustainably and profitably. That's going to be
they're speaking Wall Street terms here.
Concentrations around New Jersey. It's going to have concentrations around Georgia, where we already have presence.
Right.
What you'll see us do, again, we will expand the MA plan. We will return to growth, but it is far easier for us for when we think of expansion, I think of where do I have Clover Assistant coverage, and it's going to sound a little bit like the ACO, but
worldwide assistant coverage sound like ACO, but they're going to do it in a way that it's going to be more upside.
It's with Counterpart, we now have the ability to get those deals in other parts of the country and look just like almost like we are an MA plan in that capacity, because we're taking on that MA risk. And so that's a much better way for us to expand. We immediately get economics, we get much more scale, much more quickly. It's a much lower cost of entry.
I'm going to strike out on this question, but say 5 years from now, I look at the composition of earnings within the business.
There it is. How much? Show me the money. In 5 years from now, what is the earnings going to look like? Tell it to me now. If it was only that easy, bud. Let's see if he might give.
Would you say is core health plan versus?
Let's see.
If you look at my long range plan, I don't know it was 3, 5, 7, like a long range plan for where we would go, right? I would say that I think it would be interesting. Our business should look like we have a very significant MA plan that has been growing, that has been generating profit. It's a high profit, it's a high revenue, lower margin revenue line.
High revenue, lower margin. Okay, let's see. Okay.
Then similar, when we look at something like Counterpart, that is going to be generating higher margins, so more.
Yeah, higher margins, gross margin. I see how I got a little upset there. Higher margins. That's why I want. Okay. Mm-hmm.
More operating margin, basically, on there, and a lower cost of entry, and something that can scale a lot more quickly. So I think that you will see in the medium to long range plans that the majority of our operating profit, I would like to be actually coming from a growing Counterpart business.
Yeah, you see, there it is. They want to be more that SaaS-like business. Oh, guys, this is good.
But that doesn't mean that I am discounting a steady growth within the core. Yeah, both.
Yeah, exactly. I mean, like Humaina's doing that, and it's doing somewhat decently. So yeah, we're gonna do both. Okay.
Foundational business plus the
I hate to using a.
No, yeah, I know. I definitely got that. No, yeah. Once he said the other one, I was like, okay, that makes sense. That makes sense.
A techie lecture, the analogy would be like that's like our AWS, like equivalent. Don't draw that metaphor too far, but like it's a reasonable way to look at the world, I think.
Any questions from anyone in the room?
Good. Anyone in the room?
Peter, Andrew, thanks for joining us today. This was good. Congrats on the announcement.
This was good. This was good.
Fantastic.
Thank you. Thank you.
They freaking clap for him. Yeah. Yeah. Welcome to Wall Street. Welcome to Wall Street, baby. That's what I'm talking about. All right. So my thoughts. You know, I'm happy. That's it. Yeah. I'm really happy. And yeah, this is good. It's good. So I don't know what else to say. You know, it's gonna be good. This is. I mean, we're gonna do well, guys. This is great. Yeah, this is great. I mean, I'm speechless. You know, I mean, it's like, you know, working hard, building it, drawing it out, and then here it is. It's like, oh, wow, nice. You know, everything's working hard. Remember when Vivek was saying in his Medium post, he said, once we put Andrew Toy as CEO, a year after, which is literally what's happening now for 2024, people are going to be like, oh, wow, this is a technology company. All right. So, yes, expansion. Oh, yeah. We're going to go over that. Another video because it's already long. There's so much to go over. Oh, my God. There's Bank of America, too. I got to see that one. So what do you think about Apple route where they start off giving the CA for free to get penetration? I mean, I think that's what they did for MA to get the data. And I think now it's like, you know, we have an economic advantage to where people are going to be saving money. So it's like, hey, you know, we'll give it to you for free, but the money you save with that, we'll take some of that, something like that. Right. So this is very good, guys. I mean, let me think. We already did the calculations yesterday. It's just tough, you know. We got to see where they're at, 2025 and beyond. So, yeah, that's all I have for you guys. This is it. You know, this is we're getting there. This is it. This is it. Have a wonderful weekend, guys. God bless you, and I'll see you on the next one.